Hi, my name's Ariana and my partner's Gia, and the topic we chose was work-life balance for labor and delivery nurses. So what is work-life balance? Work-life balance means to have a healthy equilibrium between your job and your personal life. When a nurse's job completely takes over their life, their mental health suffers, they face physical exhaustion, and patient care can even become less safe. So, for labor and delivery nurses, they specialize in supporting women and families through the phase of childbirth. This includes before labor, during labor, and active recovery, which is postpartum. Their primary population includes pregnant individuals. This can be a diverse group, ranging from adolescents to advanced maternal age. Their main focus is to ensure a safe and sound delivery for both parent and newborn. Their roles and responsibilities. Typical duties include monitoring labor progress, assisting with epidural placements, and assisting physicians during delivery. Education requirements include associate's degree in nursing, ADN for short, or Bachelor's of Science in Nursing. What to expect in labor and delivery nursing and causes of poor work-life balance. Some skills you need to have for labor and delivery nursing is critical thinking. This could help in spotting signs of distress before they become dangerous. Communication is also needed to talk to your patient about any needs they have or questions and concerns. And compassion is like the last one. It's providing support and during devastating outcomes like a stillbirth, which is really sad. Work environments. Many labor and delivery nurses in hospitals base labor, delivery, and recovery suites. They're usually in that, or dedicated surgical suites. Some common procedures include C-sections. Some common diagnoses are high blood pressures, gestational diabetes, and postpartum hemorrhage. Some equipment used are fetal monitors, epidural pumps, and infant warmers. Challenges: there is high stress due to unpredictable situations and emotional extremes.
Poor work-life balance significantly affects labor and delivery nurses' well-being and the quality of care they provide to patients. One of the most common effects is burnout. The American Nurses Association, also known as the ANA, describes burnout as unmanaged chronic workplace stress that can cause mental and physical exhaustion, emotional distance from the job, cynicism, and reduced effectiveness in the workplace. Depression often occurs alongside burnout, and studies show that demanding 12-hour shifts, mandatory overtime, and the emotional intensity of nursing can increase that risk. For labor and delivery nurses, these challenges can be even greater because they work in high-pressure situations where patients' conditions can change quickly and accurate decisions are essential. Fatigue is another major effect. Taking extra or longer shifts can lead to sleep deprivation, impaired judgment, slower reaction times, and a higher risk of medical errors. In labor and delivery, where nurses must closely monitor both mothers and newborns, these effects can be especially serious. Overall, maintaining a healthy work-life balance is essential because poor balance can lead to burnout, depression, fatigue, and lower quality patient care.
You will now be shown a YouTube video skit about nurse burnout.
Fix this. I can save them. But who saves me? I want to be part of the solution. It's my job.
Improving work-life balance for labor and delivery nurses can start with personal strategies. Practicing self-care is important because it helps nurses manage stress, stay healthy, and avoid burnout. Setting goals can also help nurses create better boundaries between work and personal life by giving them clear priorities. In addition, nurses should advocate for themselves by speaking up about their needs, whether that means asking for support, fair scheduling, or time to rest. Finally, not procrastinating can reduce stress and help nurses stay organized and complete responsibilities on time. Together, these strategies can help labor and delivery nurses maintain a healthier balance between their personal lives and their work lives. Labor and delivery nurses have a rewarding and meaningful role in healthcare. because they support mothers and babies during one of the most important moments of life. One of the biggest benefits of this specialty is the ability to help patients through childbirth by providing care, comfort, education, and emotional support. This field also offers career growth because nurses can gain specialized skills in fetal monitoring, labor support, newborn care, and emergency response. In addition, labor and delivery nurses can provide strong salary opportunities and a high level of job satisfaction since nurses are able to make a real difference for families every day. Many nurses enjoy the team environment because they work closely with doctors, midwives, surgical staff, and other healthcare professionals to provide safe and compassionate care. Registered nurses are in demand all across the United States. According to the U.S. Bureau of Labor Statistics, the median annual salary for registered nurses was $93,600 in May 2025. Although pay can vary depending on the location, education, experience, and the type of hospital or healthcare setting, job demand for nurses is expected to remain high as the population grows, ages, and continues to need maternal and newborn care services. Future growth in this field is supported by ongoing needs in hospitals, women healthcare centers, and specialty care units. Labor and delivery nurses can work in urban hospitals, suburban medical centers, and rural communities, with some states and large hospital systems offering higher salaries and more openings than others.
Some key points. What causes poor work-life balance? It could be long shifts. Also, night schedules, very bad for work-life balance because when you're constantly switching between work days and work nights, it ruins your body's natural sleeping schedule. Emotional stress is also bad. Some effects could be burnout, physical exhaustion, and chronic stress. Some solutions could be productive and flexible scheduling. Having something like that you're looking forward to each day could really help your mental health. Also, prioritizing your well-being, taking breaks, going on vacation, making sure everything's okay. In conclusion, for me, I would consider this field because I think it's beautiful that you're bringing new life into this world. What interests me most was probably the dual nature of parents, because you're taking care of the mother and the newborn. Is kind of like you're taking care of two patients. And lastly, what surprised me was labor and delivery nurses are essentially operating room and recovery room nurses too.
Thank you so much for listening to our presentation on the work-life balance of labor and delivery nurses.